Hi, good afternoon, everybody. Welcome to this new episode of BHH series, episode number 6 today. So today we're going to talk about data and how can we make sense of those data. So each of us as individuals, we are generating a lot of data, being by us, our vitals, our heart rate, the steps that we do, our habits every day, the environment around us. So today with the expert, we're going to discuss what can we do with this data. And also thinking specifically in the context of the COVID-19, what can we learn from that? And what can be the role of each of us as individuals? So today I've got the pleasure to receive some experts from the field. So first we have Friedrich Lemmer, who is the managing partner of Thrive. Valeria Righi, who is the co-founder of Salus.co. And Manish Juneja, who is a digital health futurist. So Manish has been, I've known Manish for many years. He's been using a lot of different devices and wearables to check his vitals. And also, so those past weeks, so he will tell us more, but he's been suffering from COVID-19. He's been using all those different devices and wearables to track his data. So I thought it would be very interesting to learn from him. And yeah, so Manish asked me to share with you that he's still not feeling too well. So just in case maybe he won't be able to talk too much, and in case he gets like a fit of cough, just to excuse him. So now I'm gonna ask the speakers to introduce themselves. So two minutes each. Friedrich, do you want to start?
Sure, with pleasure. Hi everyone, my name is Friedrich. I'm one of the co-founders and CEO of Thrive. We are a Berlin-based specialist for the aggregation and analytics of health-related data from smart devices. So all kinds of wearables, smartphones, connected medical products, but also lab tests, consumer-facing, microbiome checkups, everything that helps digital health services to understand personal health. You're seeing this here in this kind of animation. We enable it to be used in an easy and simple fashion to improve early detection of diseases, prevention, and ultimately cure. We're the engine that enables this overview of different manufacturers, different data silos, that all flow into one single data stream into the application that is integrating with us. And on top of that, we provide specific analytics about the individual's health status that enables us to detect also things like the COVID-19 symptoms that we'll probably talk about a bit more in an instant.
Thank you very much. Valeria, do you want to introduce yourself?
Yes. Hello, everyone. It's a pleasure to be here. I'm Valeria, and 3 years ago, together with a group of 10 people based in Barcelona, we founded Salus.co. I dare to say that Salus is the first in Spain citizen cooperative of health data for science. In Salus, we aim to legitimize citizen rights to control their own health data and to foster people to share this data to accelerate research innovation in healthcare. So we want to make explicit that the ownership of the data belongs to those who produce it and not to those who collect it. And in the last years, we have done quite a lot of activities for raising awareness about the value of data among the population and to understand under which condition people would be willing to share the data. So during this COVID situation, we have launched a manifesto in reference to this COVID, in which we absolutely recognize the need for public authorities to access our personal data in order to manage better the progress of the epidemic and easing the lockdown measures. But at the same time, we should not forget to keep promoting people's active role in managing the data. So perhaps I can give you more detail later in the talk.
Perfect. Manish, do you want to introduce yourself?
Yeah, so Manish Juneja, I work for myself from here in London as a digital health futurist. I'm effectively scouring the world and the internet looking for what's coming up in the future, what it means for different types of people and organizations. But very quickly, to give you my background, especially I basically built my career working with other people's data. So even if you live in France or Germany or the UK, chances are during my career at GSK, for example, and even afterwards, when I've been analyzing real world data from GPs or hospital settings, I might have analyzed your medical records, albeit you were anonymized with a patient ID. But then even in my career, I've analyzed if you shopped at the Tesco supermarket in the UK, I've analyzed how many bananas you've bought and how many biscuits, etc. I've analyzed banking data from companies like Western Union to see who's sending money where from within Europe. So all of this is really about using data to improve decision making. But then since I left my job 8 years ago at GSK and working on my own, effectively, I'm looking at all these, especially consumer health sensors, not necessarily medical devices, but patient-generated health data. Where does it come from, how it can be used, and how, in an ideal world, we can make the link between what we can collect at home ourselves and how it can be linked to what's collected in the doctor's office to actually provide a 360 view of somebody's life in terms of their health.
Fantastic. Thank you very much, everybody. Can we put the Menti slide, please? So this week we're going to use Menti again. For those of you who were here last week already, we're using Menti to integrate it more in the session. So if you go to menti.com and then they will ask you to enter the code. So you enter the code at the top. And can we go to the first slide? So when everybody is ready, we can start with the first question. So curious to know, all of you, if you are tracking your data vitals. So yes, no, or yeah, I used to, but like I've put the wearable in my drawer and I'm not really using it anymore. So we're gonna leave that for like about 20 seconds, 30 seconds. I mean, maybe just the speakers, can you share, like, are you using, Manish, I want to ask you, because I know like Friedrich and Valeria, are you tracking your data?
No.
Okay.
No.
Well, from my perspective, of course I do. We are a specialist for health-related data coming from everyday devices. So everyone with us is tracking some sorts of data with the different devices. Basically, every device that we integrate, we try to test. I'm personally wearing a Withings smartwatch right now. There's connected scale, connected blood pressure monitors, blood glucose monitors, everything that you like in the office, and I've tried basically all of them.
Okay, perfect. So can we see the Menti for a second? Okay, so can we go to the next slide, and we can let the people answer while we're talking to Manesho, asking you what data vitals you are tracking exactly. So you can just enter words directly in the system. So Manish, let's start with you. So can you share a bit with us? Telling before, you've been suffering from COVID-19 symptoms those past weeks. You've been tracking your data with different wearables. You've also been sharing your experience on Twitter, on social media every day, which is very, very useful. So can you share a bit your experience with us?
Yes, thanks, Celine. So just to clarify, everyone, I have a diagnosis of suspected COVID-19 because I still haven't been able to access a test here in the UK. But this probably started about 4 weeks ago. So actually the first symptoms of the classic symptoms of things like a cough, and the cough started. There's no fever. Cough started exactly 21 days ago, so 3 weeks ago. But before that, I had this weird muscle ache in my calf muscles when walking every day in the morning, and also some weird pain in my joints in my feet. But I didn't connect that to COVID-19 until after I started getting the cough and the shortness of breath a week later. And then I was going online and looking, and then and actually when it comes to the first day when I had the cough and the shortness of breath 3 weeks ago, I initially, when I went to symptom checkers in the UK and I tried a whole bunch of them, all of them were saying you don't have COVID-19, just take honey for your cough. So I was like, oh, okay. But then I tried the French government symptom checker, and that says you have COVID-19, go to rapid care. So I was like, wow, this is really weird. And that's when I started tweeting about, like, this is really weird. I'm confused as a patient, right? But then in terms of tracking my health, then I was asking friends who are doctors, I was looking at Twitter, just browsing Google, what should I be tracking given that the government here, the healthcare system, doesn't feel that I have COVID-19 according to the official definitions. So then one of the first things I bought was a pulse oximeter to measure my oxygen saturation. And then I was trying to measure my temperature. So I got like a digital thermometer. And then obviously I have an Apple Watch. So I couldn't find my AliveCor, the ECG, the sense that I had. I lost it somewhere, and I was too tired to search my desk. I was getting fatigued, so I was like, oh, actually, I have an ECG built into my Apple Watch, so I can take that reading and find out, do I have an abnormal rhythm or not? I didn't. And then I also have the sleep sensor that is underneath the mattress of my bed from Withings, that you can see your sleep, your heart, you can see your breathing rate, your heart rate, and whether you're having some disturbances. So that was useful. And then as well, obviously blood pressure. So I then realized, oh wait, I've got this cool blood pressure watch from Omron that it's cuffless and you put it on your wrist like a smartwatch and you can track your blood pressure. But when I was trying that out, and remember, this was in the first few days when I have these awful symptoms. I've got headache, I'm confused, I'm exhausted. So I put it on, I followed the instructions, and it's not giving the blood pressure reading, saying it has to be aligned at your heart level. So I tried it 10 times and it's worked before, and it's like I tried it 10 times and it didn't work. So I got fed up because I wanted to know my blood pressure. So I relied upon this very traditional, standard sort of relatively basic blood pressure monitor. And essentially, I also, the most important part, apart from obviously giving me a sense of, I didn't actually start tracking until maybe 4 or 5 days of symptoms, because I thought, oh, it'll go away, because it's mild symptoms. And the longer it went on, the more I thought, oh, I wanted to be able to see some data, partly because to give me a feeling of control, that I'm at least able to see what's happening to my body. And second of all, it actually surprisingly helped with I managed to eventually get through after about a week to speaking with my GP. And the GP, I was saying, oh, by the way, I've been tracking my data with all these consumer sensors. I'm not sure if you want the data. Because normally the doctors don't like data from a Fitbit or something they've never seen before, right? How can they trust it or it's accurate? And she's actually said, no, give me the data, Manish. What have you got? So I was giving her all the data, and that helped to understand whether to bring me into the hospital or the doctor's office or recover at home. And then we were doing that every day for 4 or 5 days. I was giving her the observations on the phone. And in my NHS app, 10 minutes after the phone call with her, I could see she had put in the data from my Apple Watch, the data from my blood pressure monitor, the data from this that I had given to her verbally. I was thinking, it's a kind of like a very rare, unusual situation, because she's almost forced to trust the data that I'm verbally telling her. She has no way of verifying. She has to trust me and whatever these consumer sensors. But that really proved useful to her, and she was like, oh wow, you're like almost helping me deliver better care for you and make a better assessment of your health. So, and then I've also got this Oura ring, so here, so this is this ring that I then realized, oh wow, I've got this because then they started a research study with UCSF in America, where anybody in a number of countries around the world could enter in the study if they have this ring, contribute their data, and it's helping them build a predictive model of combined with the survey you fill in every day and the data from this ring of how could we use this hour data and the survey data to build a predictive model of when people are going to have COVID-19. But yeah, so and then I've been filling in other symptom checkers where they're asking for how you're feeling every day, because it's like, well, if I'm sharing, I might as well use some of these research apps that are trying to build a picture of how widespread COVID-19 is in the UK and how the symptoms are going up and down. And that's basically it.
Thank you very much, Manish. Yeah, very insightful, very, very interesting for those of us like who didn't go through it, or yeah, very interesting. Friedrich, so you have been developing an app those past weeks, so using your capabilities and know-how. So you launched a digital infection detection app for the people like Manish who are collecting their data to donate. So can you tell us more about that app?
Yes, with pleasure, of course. So basically, Thrive acts as this data access engine for around 50 customers all over Europe in a variety of different use cases. And when COVID began to hit Europe in February, everyone was like, how can we manage this? Our science team came up with the idea to look for markers for COVID-19 infections in the kind of data that we process every day. And fortunately, Eric Topol, the, I think, most known digital health scientist, had published a study on influenza symptoms detection before. So we used this as a basis, ventured out, fostered through our data, tried to understand the potential differences, and then got in touch with the German Center for Disease Control just to find out whether they would deem this useful in managing the crisis. And it turned out that even though it's not medical grade, just detecting indicators, it's light years better than what they have at the moment. Currently, for the Centers of Disease Control, they need to have a doctor's diagnosis, which takes time. Much like Manish, you wait a bit, you don't see the doctor, it takes time until they get the results, then they need to communicate this to the municipality takes time to transfer it to the Center of Disease Control, etc. So what our solution does is, it's an app that enables people to share their wearable, whatever they bring. We have a simple analytics engine that analyzes the data and creates a likelihood based on different models for a COVID-19 detection, completely without individually identifiable information, on zip code level and within 24 hours available. So for the Center for Disease Control, instead of municipality level and a potential 2 weeks delay, they now have zip code specific information almost instantly. So this helps them to improve the models and to better understand where actually there are new hotspots, how infections proceed, etc.
And how easy would it be to implement it in other countries like Spain, for instance?
Well, it's a digital solution, and luckily we live in the European Union that is a single coherent business area. So it's plug and play if you wish. And in this case, with the German Center for Disease Control, the core is our engine, and our engine there is no interface to it, so it easily plugs into any other solution that may already be there. So this is something that you can basically take and set live within a week in any other place.
Okay, great. So now, can we put the Menti? Can we go to the next slide? Just curious to know which wearables the people are actually using. Yeah, so which wearables or sensors are you using to track your health? So while you reply to that, Valeria, Can you tell us a bit more about Salus-COP and what you were mentioning before, the manifesto for COVID-19?
Yes. So this last weeks we have launched these manifestos, which we invite everyone, if you agree to adhere in the manifestos, is in our webpage. So the idea is that this COVID situation has raised a lot of awareness about the value of our data. And we absolutely recognize that suddenly public authorities needs to have access to our personal data in order to manage better the situation. But at the same time, it seems like we are forgetting about the notion of the citizen that needs to manage their data, the citizen that needs to be in control of the data. So with this manifesto, we invite public authorities to keep enacting the right of citizen to know under what condition the data will be used, for what use, by which institution, for how long this data will be used, and in what level of anonymization. Also, individuals have the right to obtain the result of the studies carried out with the use of their data at no cost. So this is something that it's important to stress. We want to contribute with our data, but at the same time, remember to give back us the result of the studies that we are conducting with this data. And also what we want to stress is that people could contribute with additional data that are given on a voluntary basis. And this additional data could be used to complement and enhance the interpretation of data that is obtained in another way by public authorities. So again, some of the way in which this right could be enacted is through the use of licenses for data. So very similar to the licenses for Creative Commons that have been widely adopted in the creative industries. In Salus, in last year, we have developed the Salus-COP Common Good License, which basically represent under which condition the member of Salus-COP will be willing to share the data. And this condition are that data will be used for research, mainly in relation to chronic or rare disease, that data will be no economic benefit as a result of that research, that the result will be shared openly, and we will guarantee privacy, so the data will always be anonymized, and that at any time the person who is submitting their data may exercise the right to opt out or stop sharing their data. So of course, given this COVID situation, perhaps this license, I don't know if it's still valid or not, but what we want to promote is to think about and to implement such licenses. That is a way to easily give people the control over their data.
Okay, and how do you, that would be a question for both Valeria and Friedrich, how do you convince like citizens, people to donate, to share the data, and how do you make them aware of what you're doing, the app or the manifesto, the platform? Valeria,
when it comes to the app that was launched by the Center for Disease Control, we were actually flooded by the feedback of the population. So scientists initially said that they, for a country of the size of Germany with its 80 million plus inhabitants, would need 10,000 participants for meaningful results. 10,000 participants. It's a lot less than every tracing app would need. And they said 100,000 would be great. I think within 2 hours, we went to the first rank of the app stores and had onboarded 300,000 users. So in this situation of lockdown, where everyone is confined to their own room, fighting against an invisible enemy, everyone wants to do something. And the solution that we created basically offered a fully pseudonymous system. There is no name, no address. So this was an easy way to help public authorities to get a better grip on the crisis. So the publicity was there by itself, and there was an incredible reliability or an incredible willingness of people to actually do something about it. And just a quick remark to this. I think the long-term effect of this is yet to be seen, but there's now 500,000 people that understood what they could do with their wearable data in a medical setting and how that can help in the healthcare system. And I think this will have a much more profound effect on the way we think about healthcare than we can now even imagine. So, the last crisis has been financial, and there's been a lot of innovation afterwards in the financial crisis with a lot of new regulations. This crisis is in healthcare, and there's been a lot of need for new regulation and new solutions in healthcare. So maybe this is the start of something that is very new.
Exactly. Valeria, do you want to add something?
Yeah. I think the topic of incentive on sharing data is a very interesting one. In fact, during the last year, we have conducted several conversation and co-creation workshop with citizens because we were interested to understand under which condition they were willing to share their data. So what we found is that value is a very important elements. So people need to see and to understand the value of the data. If they don't see value in the data, they wouldn't play an active role either in sharing the data or in protecting their data. And in this all COVID situation, one of the positive impact, I would say, that is COVID raised a lot of awareness about the value of data and also the value of sharing data. No, suddenly the managed GP is willing to receive data from Fitbit, and suddenly we all understand that if we could have real-time access to symptoms of data of everyone, everything would be much more easy. So COVID has shown us how data can benefit research, but also can hinder research and social well-being. So during the last 3 years, I would say that we found that there were two basically profile of people. I mean, people expect to receive something back when they most of the people, not all of them, of course, but most of the people expect to receive something back. But this something doesn't need necessarily to be money or a monetary incentive. In fact, most of the people which we have interacted with, they explicitly say that they didn't want to receive money in exchange of their health data. So I think there are some people that see an intrinsic benefit in sharing data. So let's just contributing to research is an incentive for them to share this data. But there are other people that would like more explicit incentive. And for instance, if I participate in a health research studies, I want to receive personalized information about my health, or I want to receive the result of this research. Perhaps in this situation of emergency, it seems like everything is shifting, no? And something that also changed. And I would say that receiving individual incentive is now considered less important because everyone understands that the benefits for society are bigger than any individual incentives.
Well, I think that depends on culture and countries. It's a Manish, the discussion that you and I had a few days ago, right?
Yeah, so it's really interesting that you mentioned that. So one of the things that I was tracking, like the others on the call, when, like for example, when South Korea was taking action in February, and before things really started to blow up here in Europe, I was like, oh, wow, this is really interesting how they're using data, because I found a website, I think I shared it in the chat, but it's coronamap.live, and essentially, 5 years ago, when they had a MERS outbreak in South Korea, the public afterwards said to the government, next time this stuff happens, we actually want data made publicly available about cases and infections so we can know where the outbreak is happening in real time, right? So then the government changed the actual rules after public demanding that. And then now, when they had this COVID-19 outbreak, and this has helped them tackle it in a better way than other countries, they then published all this data publicly in real time. And so then it was up to people who are developers. There was even a husband and wife couple as a developer who built an app to help people, based upon this public data, work out where the cases are happening. But with this coronamap.live, what's really fascinating is that you can go, for example, on any, you can see all the stats on cases, deaths, and recovered. Then you can also see in a particular area, wherever you happen to live, you can go down and it'll tell you, like, there's somebody, a case who's aged in his 50s, so the gender and the age group, and you can drill down and see which routes they took before they were a case. I can actually see this guy who's in his 50s in a part of South Korea, and it says on the 19th of April, 10 days ago, he was at Costco for 2 hours, a supermarket, right? So suddenly you get this level of contact tracing there publicly that you can even yourself go, oh, I was at that Costco 2 weeks ago, or 10 days ago. So I think, so me personally, given that I have shared, I was wondering whether I should share that I've got these COVID-19 symptoms on social media, and that maybe there are clients watching and reading saying, we don't want to meet up with him in the future because he might still have the virus and infect us, right? So, but I decided to share anyway, because I thought it'd be useful. But going back to then the whole privacy thing, Aline and others, so I think that we have to remember that we may be looking through the lens of data sharing and what different people want based upon where we are living in the world and what our cultural values are. And around the world, again, another example is from China, where they may have different values than us. And I remember seeing a screenshot of somebody who had ordered home delivery, like takeaway food, and the motorbike driver is coming to you and it shows you on the map his or her location. So in this app in China, they are actually sharing in real time the body temperature of the delivery rider bringing your food, because 80% of people with COVID-19, their first symptom is high fever. So this level of radical transparency, you can say, is almost at odds with GDPR and our cultural values here in Europe. So I think it's really interesting to see what's happening in other countries, especially those countries that have had relatively better success at containing the outbreak, and also possibly then populations which have got different attitudes towards how public data should be and who could share it and who can use it.
I feel that those past weeks, month, and Friedrich, maybe you can explain more on that, but that the GDPR was not so important, that we bypassed GDPR, because the benefits of collecting those data or using those data was more important than following the actual regulation?
No, I would happily want to put some spice into the curry there. I think we're perfectly fine with GDPR regulation, and I'm actually happy that we have it. Like me personally, coming from a European background. And I think we have a lot of freedom within the GDPR. So it's based on consent. You need to be aware of which kind of data you're sharing. And then you're actually pretty much free to use the data. But just you as a data subject you don't lose your rights. Whether, countries like China that, well, I think pretty universally accepted now, just covered up the whole thing before it really fired up, is a role model for cleaning it up again. I'm not really sure about that. And in South Korea, I'm also not sure how big the effect was of this kind of tool that you were talking about, Manish. It's good always to see other solutions, but I think the kind of standard that we have in Europe is a very high and precious good, and we are now in talks with other countries that are asking us specifically with respect to all the regulation that we fulfill here in the European Union. And for us, it's even a sales tool, if you wish to say, to be able to say, we know where the data is, there is a strong consent for what we are doing, it doesn't need to be on an individual level, etc. So I think there is the opportunity to work with this kind of data in a fully transparent and a compliant way, also in a crisis like COVID-19.
But very quickly, I want to respond to that, Frederick. So when I looked at this again, this is anecdotal evidence, but the quotes from members of the public in this article about these apps and public data and being able to see who's infected and where helped remind people to stay home or to take more precautions, right? And I got the same feedback when I voluntarily shared my symptoms and what's happening to me every day on Twitter, because then there were people coming back to me either privately or publicly on Twitter and saying, hey, you know what, I wasn't taking all this virus stuff seriously, and now that I've seen your tweets and how crap it is to have COVID-19, even mild, I'm staying at home, Manish, right? So that was really rewarding in a way. It made me think about, actually, maybe there is this argument to be saying it could be. Again, as you point out, we will probably need, at least during this wave, some kind of longitudinal research studies to understand the true impact of this type of data being made public, whether it's voluntarily like me, or in South Korea where it's sort of the public wanted it, and in China where the government just says we're going to do it and we don't care.
Exactly. Manish, maybe a question for you. So you've been tracking your data and using a lot of different sensors over the years. I think you like my reference point. You always have like the last sensor. So I would ask you if I needed to choose a sensor. How relevant and accurate are the data collected by those sensors that you've been trying?
Okay, that's a great question, Aline. So I'm using a mixture of sensors, like, for example, the one with the ECG that can tell you whether you have an abnormal rhythm or not. That is sort of a medical device, rather than, say, a Fitbit, which just counts your steps and you can use it to understand trends. But to give an example of accuracy, and one of the things that really made me laugh in the beginning of tracking my health data since I got the symptoms. So this Oura Ring, which is from Finland, and they claim that it's the most accurate wearable in the world. And like I said, there are all these validation studies and researchers doing studies with it right now. And but it collects your activity, right? A bit like my Apple Watch will tell me how many steps I've walked, even though for the last 3 weeks I've been sitting in my room or lying on my bed, I've been resting. I haven't even been down the rest of the house much. So I haven't really been walking that much according to my Apple Watch. However, when I use this Oura Ring and I look at the data one day, and I think I was telling you, Aline, I was lying in bed most of the day, or sitting up straight in the bed because I felt exhausted with the symptoms. And the ring at the end of the day reported that I had walked 13,000 steps, or about 1.8 kilometers. And I thought, that's just impossible. And it was doing the same thing afterwards, 10 kilometers the next. I thought, this is crazy. I thought, how can these researchers be using it for a study tracking COVID-19 when it's clearly wrong? And then I discovered, searching in the FAQ on their website, the sensor in this ring actually tracks all motion and movement. So because I am not speaking much to save my breath, and I'm swipe typing on my phone in WhatsApp to communicate to people, it is counting my fingers swiping on the keyboard as activity and whatever. And so that's why I'm getting the app saying you walked almost 12 kilometers despite being in bed. So that is kind of like a mixed message. So there are some things I'm using, like the watch, that are sort of validated to a degree, but then I'm also using things which are producing values that don't make sense until I, as a consumer, have taken the time to dig out why is it coming out with really weird values, and now I don't even look at that activity data on the ring.
Okay, thanks, Manish. And also maybe it's a question for all of you. what benefits can like citizens, individuals get in like once you collect those data and you analyze those data? So like Friedrich in your like as Thrive, you make sense of those data. What are the biggest benefits on that can be translated into action points for the people?
So what basically the data that we collect enables is to act early on. Right now, we are confined with everything that we do in healthcare to a doctor, telling us, this kind of symptom of yours, oh, I will understand it, and I will tell you it's X, Y, that. And you need to go to a doctor's office, which also, side note, in COVID-19 times, everyone understands it's nuts if you're ill. You shouldn't be sitting in a doctor's waiting room if you're ill. You either infect others or you will be infected by others. So what this kind of sensors enable, and to a growing extent, they get better by the day, is to understand health early on and to act proactively, either to understand earlier if there is a disease, or to understand earlier cure is not working, if a disease is deteriorating. And we are seeing this in the front runners of digital health that are providing services that tune to you individually and provide transparency about correlations and potential determinants of individual health progress. But it will also help in teleconsultations, remote care, everything that is brought up now in this COVID-19 maelstrom that we're in. So I think this will be truly transformational in terms of what we understand with the data, what can be done.
Okay. And how can we ensure like the unification of those data on a global level? Like, for instance, Manish, you were mentioning at the beginning that you did the triage solution, the symptom checker.
Yeah.
In the UK and France, like if different systems are collecting different type of data, how can you compare the different countries? Or
Yeah, so that was really frustrating to like, wait a minute, like depending upon which symptom checker app I'm using, even from the same country and putting the same symptoms in and the same age and gender, it's coming out with a different recommendation or suggestion of what I might have. And then even then, when I was thinking about symptoms, what was useful just sharing on Twitter is that I was then getting feedback from other patients around the world who were saying like, oh yeah, I've had these weird symptoms as well, but they're not on the CDC website. They're not on my government's website, or my doctor doesn't believe me because these are not what their computer says. So I think this is why I've got the background of Collaborate at the moment, because I think it's really important. And I think at the moment there's so many different apps and people, well-meaning teams saying, we're doing a study here, we're doing this thing here, and collecting data, we're going to end up in a bad position where we're going to have pots of data sitting around, even in the same country, right, about COVID-19. So at a global level, we really need much more coordination and collaboration to say, how can we bring all these different pots of data together, even if they sit in different data sets, as quickly as possible? And in particular, going back to my earlier comment in the beginning about linked data, I was thinking, well, not everybody can afford the €150 mattress sensor that tracks my sleep, right? So, but a lot of people have got, say, for example, Netflix subscriptions. So why can't maybe Netflix, when they know what time people are stopping watching the TV shows every night, they have a baseline of people's sort of last watch time, then they kind of have a proxy for what time people are going to bed. So given that insomnia, which I had and still have, is one of the early symptoms of COVID-19, maybe if we can get access to Netflix data and repurpose it for health purposes, we can say, oh, this is an early warning sign that some people are having insomnia here, even if we can't afford to give everybody a sleep tracker. Does that make sense in terms of thinking differently? Yeah. And integration?
Exactly, yeah. So we're going to take some questions in a minute, so you can drop your questions in the chat, and we're going to address them with the speakers. Valeria, do you want to make some comments on what was said before, like a point of view here from Spain or from Italy, maybe, where you're coming from?
No, I was just curious the question that you just asked about how we can unify the data on a global level. I mean, it's complex question. Of course, I don't have an answer, but what is most interesting to me during this day is realizing how people are getting more and more aware about the value of the data, but also of the limits of the data and the difficulty of many data sharing initiatives. So it's not easy to share data across hospitals. And there are now a lot of initiatives from different hospitals across Europe that they are trying to share data about COVID, because researchers are really willing to share, but data are not ready to be shared. And if your data is not ready to be shared, it seems like if you don't have this data, no, at least in some situation. And also the fact that the way in which the different countries has count debt, they have used different approaches. So the value of that seems to be easy, like the number of debt, in fact, has been counted in a different way with a different criteria. So this data is assume a different value in different country, and it's very difficult to compare. So of course I don't have an answer to the question, but to me it's interesting to see how people, it seems like the data literacy of population has increased during this period.
So Valeria, you make a really good point there about the definitions and methodology. So for example, now I'm reminded that when I went to the UK NHS symptom tracker, which is the first place I turned to, it says, do you have a persistent dry cough? And they tell you what persistent means. I was like, well, I have a dry cough, but it's not persistent according to their definition. So I click no. But then when I go on the French government website, it's like, do you just have a dry cough? And do you have it once a day or several times a day or whatever? Like, oh, well, so different people are defining the cough in a different way. And as a result, I'm going into a different part of the decision tree for the symptom checker. So that's a very valid point about we need to have agreement, maybe across Europe, of how are we defining the symptoms of COVID-19 together.
I think just to add to this as well, you know, this is the first time that people like us are actually getting transparency on medical decision processes. Like your doctor, your general practitioner would basically do completely the same thing, and you would just never realize it, that, you know, decision trees with doctors are as different as the public questionnaires. So I think we're moving ahead there, and I mean, it's a value in trying out different things and be able to judge which one works best. But I think it's also a value by itself to understand how medical decision processes are working, what kind of data you have that defines your current health status, and how this is analyzed, and what the actual result is in this. And I think sensors will play an incredible part in that.
Okay, so let's, so we don't have question yet in the chat, so let's carry on.
I've got a question, Aline, if I may,
yes.
a controversial one, so because it's been on my mind. What data do we need, if any, to prove to others and the rest of society, government, my clients, work, whatever, insurance company, that I'm no longer contagious and it's okay for me to move around and travel and go on the bus, right? And the same with anybody I meet. So how do I know that you, Valeria, when I meet you, you don't have COVID-19, right? And so it's I can trust meeting you and hanging out with you. And then I was thinking back to, again, China, where some of the earliest examples where they're doing this big data and algorithms to put you into one of these different health codes. And so one guy was complaining where he was saying, well, they put me into the red code, meaning my travel was restricted by the algorithm. And when I tried to phone up, there was like an auto bot that just says, we can't do anything. We're too busy dealing with COVID-19. So your travel's restricted, just deal with it. But he knew he had been falsely identified as a case when he wasn't a case. So that's a question for Valeria and Frederick. How do we, and even Aline, what data are we going to use in our country to know that we can trust each other? It's safe to go out again and work with each other.
I think this is a very good question, and it's first and foremost a philosophical question. So, what kind of trust do you need to interact with someone else? Is this a decision that your government should take for you? Is this a decision that your general practitioner would take for you? Or is this a decision that you yourself would be taking? If you answer that in a way that the government should have this responsibility, then you can ask about the steps that come after this. But I think one of the first questions is actually, is this a role that we in Europe would see with the government to decide in our society whom we are supposed to be meeting or not?
I mean, I'm going to be carrying my temperature, my thermometer with me and checking everybody's temperature when I meet them to make sure they're not sick. If they allow me, if they give consent though.
What if temperature is actually not one of the symptoms? Like some people can have,
exactly.
You didn't have really temperature, right? So if I was testing you, like it would be, yes, that's fine, I can hang out with my nation. Maybe you do have COVID and then you're going to infect me, right?
Yeah. Or do I want to see, I mean, this sounds crazy, but is this even theoretically possible? I would want you, Eileen, to share your health data from your sensors in the cloud when arranging a meeting, or even when I'm about to turn up and I'm on the metro, just to be able to go like, okay, yeah, like according to all these sensors, she's got no cough and she's got no fever and no headache, so whatever, and her heart rate is this, so I'm okay to meet her. And I'm using an algorithm that tells me how to that interprets other people's health data and tells me, yes, it's safe to meet them with 90% reliability of answer. I don't know.
Well, I'm not sure I would trust data as of now. I think masks and being prudent, keeping distance, for me will be the best trust at the moment.
I like the answer from Frederick. I think it's a philosophical question, no? It really depends on the way in which we build trust among each other, and also which data we will be willing to share at some point, no? About us and for how long. I would invite actually we should run a study on this and publish probably the answer, the question in social media, and see what the people answer, and decide all together, no, which kind of data we will need in order to trust each other.
Because so Valeria and Frederick, there was the recent headlines about the possibility of some countries, Germany, UK, were considering immunity passports or certificates based upon antibody tests that will tell you, do you have some kind of immunity? And then you're allowed to go back to work and mingle in society. And then those who don't have the immunity passport are denied those freedoms, right? And have to stay at home. But then I was also, so the WHO said recently, I think last Saturday, there's no evidence that this immunity is guaranteed or how long, so we can't rush into the immunity passports. However, when I was also thinking, is like, imagine, in 3 months' time, these tests are accurate and you can define immunity and get a passport of some kind. What if there are criminals or anybody who says, well, you know what, I'm going to pay to falsify my data and hack my way in the system so that I can show that I've got a valid test result and I have the immunity, even though I don't, and then I'm free to mingle. And then I could infect people. And so there's that kind of risk as well, which is more of a technical challenge. But again, like, how strongly are we going to enforce this or these measures?
I think this is, it's a very theoretical scenario. So there's been this nice comparison. We would avoid a lot of death if we would force every car in a city to drive less than 10 kilometers per hour. But we don't, due to good reasons. We can forcefully think about a lot of weird scenarios, how to handle the current infection. That is deadly, but then again, it's also not super deadly. And it's most of all about assigning resources and ensuring that healthcare treatment options are there. So this has been also the central idea behind the tool that the German Center for Disease Control created, that you're able to understand on a regional level whether there is potentially critical path or not, and to be able to ramp up care capacities. So luckily, this country has managed the crisis quite well so far. So this is also, I think, just a potential showcase of things do not all need to go very bad. If you plan ahead, and if you have the resources to understand healthcare, for the affected ones, for the ones most at risk, then there is a good chance that you can avoid all those kind of, passport tracing, forceful solutions, and go back to a state of normal. Actually, also enhanced by sensors. So Manish, you probably in the course of your exploration with COVID-19, checked your blood oxygenation, which is supposed to be one of the strongest markers. And,
yes.
Withings, the French medical devices manufacturer, or Fusion, consumer wearable medical device manufacturer, they will most probably add something like this to their wearables. So
yeah, it's coming out in later in the year, their Scan Watch with the sensor in it, I believe. So
for us, or for people with these kind of sensors, this actually gives back a sort of also self-control, right? You're able to check you yourself. You do not need to go to the doctor, but you at home, you can take all those measurements and get to grips with your health status. And I think this is a huge advantage, not only in this crisis where it provided transparency, more transparency, Manish, for you, but also in how the healthcare system will actually provide services in the years ahead after the crisis.
So rather than sort of a data-driven algorithm by the state that's going to decide what we can do or can't do in COVID-19 and afterwards, you're talking about still using data and sensors and also a degree of common sense, but also some level of personal responsibility by individuals rather than having to rely upon the state and the government and big authorities to govern what they can do. Am I understanding you correctly, what you just said then?
Well, it's about empowerment. The kind of data, the fact that you yourself have sort of a doctor's lab at home with all those kinds of wearables and of sensors gives you more control and more transparency about your health and how it is managed. And I think this is something really positive.
And reassurance. So because I was monitoring my, says, oh, cool, you've got this device, just monitor it 3 times a day, even when you start getting better. And if it drops below like 94%, plus your breathing gets worse, plus something else happens, go straight to the hospital. So then I felt like, oh, reassured, like, wow, like I have something, a tool that allows me to understand what to do or what action to take based upon some level of a data parameter.
Yeah, I think this is how it will work in the road ahead. Things will start to more and more be user-centric, not patient-centric, but user-centric. Not everyone is a patient. We're people after all. So we are now seeing a healthcare system that more or less wraps around us as individuals instead of, waiting in line in the doctor's waiting room.
Exactly. Felix, I think that was a very nice way to end up the session today. Thank you everybody for your insights, for sharing your experiences. Thank you for those who are watching today. We're meeting next Tuesday, so we're changing day next week. On Tuesday, 5 p.m., we'll have a session in Spanish, and we're going to talk about telemedicine with a focus more on users, on the end users. Thank you for being with us today, and stay home and stay safe. See you soon.
Bye.
Thank you. Bye.
Bye.